COVID-19 pandemic has made changes on many aspects of our lives, but what was its impact specifically on pharmaceutical care? I am Ramal Khawalde.
And I'm Siddiq Matrajim. We are participating in DFAT in its 26th edition. I'll be presenting about what has changed in the pharmaceutical care after COVID-19 from pharmacist perspective.
This poster is authored by us along with Mr. Ahmed Al-Muslimani, supervised by Dr. Bilal Jaber, representing Al Ain University Abu Dhabi campus. So let's get into it.
Since day one of the coronavirus outbreak in December 2019, pharmacists have played key roles in the management of this pandemic and in supporting the healthcare system. New challenges and responsibilities were held by pharmacists, which contributed to the potential changes and expansion in their roles and the pharmaceutical care provided. However, the nature of these suggested changes remained unexplored, which calls for additional research.
In our study, we aim to investigate the impact of COVID-19 pandemic on the roles of both community and hospital pharmacists in the United Arab Emirates, specifically in regards to medication dispensing, medication review, patient education, and lastly, pharmacy automation. Now, in terms of methods used in this study, we conducted a face-to-face questionnaire-based study over 2 months on a random convenient sample of hospital and community pharmacists across the UAE. We collected a sample of 238 responses on a semi-structured questionnaire.
The questionnaire comprised of 5 parts with close-ended questions, which were about socio-demographics, medication dispensing practices, pharmacist's role in patient education and counseling, pharmacist intervention and medication review, and lastly, questions about telepharmacy practices.
Now moving on to the fun part, which is the results. 71% of the pharmacists stated that the dispensing rate of over-the-counter medications or OTC medications has increased since the beginning of the pandemic. An overwhelming majority of 94% acknowledged the increase in vitamin dispensing rate. Interestingly, 72% of the interviewed pharmacists in the UAE are now more engaged in patient medication review since the beginning of the pandemic.
Not only that, but 54% of pharmacists mentioned an increase in their intervention and alteration upon prescriptions, and 35% described an increase in physicians' acceptance to such interventions. Following the regulations of social distancing, 72% of pharmacists provided remote dispensing of medications, and 77% made virtual consultation for patients all around the Emirates. As confirmed by vast majority of pharmacists, these telepharmacy services made pharmaceutical care more accessible to all patients even through these hard times.
Finally, COVID-19 pandemic has led to clear changes in the pharmaceutical care and pharmacist roles. Also, pharmaceutical care is moving closer towards a patient-centered approach as seen with the increased engagement in medication review, patient education, altering prescriptions, and virtual consultation services.
This study acts as groundwork for future research targeting the transformation of pharmaceutical care in the UAE. Stay safe, happy, and healthy, and see you in DFAT.